Hey everyone, it's Nurse Sarah. In this video, I'm going to do a quick review over the key test concepts over the contraceptive known as the cervical cap. And as always, whenever you get done watching this video, you can access a free quiz that will test you on this content. So let's get started. How does the cervical cap work? Well, it is a small silicone cap that covers the cervix and it's used with spermicide. So what it'll do is it'll block sperm from entering the cervix, plus that spermicide will kill any sperm it comes into contact with. Now, what are some things that you want to remember for exams about this device? Well, this device I'm particularly talking about is known as the FemCap. So with the FemCap, it has to be provider fitted. It's not something that you can just go and buy over the counter. It can be inserted before intercourse up to about 4 to 6 hours. However, a big thing you want to remember is that after intercourse has occurred, that this device has to stay in for at least 6 hours to work properly. However, the total wear time cannot exceed 48 hours. If that happens, it increases the risk of a condition called toxic shock syndrome. So let's talk about this syndrome for a moment. You want to educate the patient on how to recognize if they have developed this. So remember this mnemonic I created called TSS. T is for temperature increases. There's going to be this sudden fever, typically greater than 102 degrees Fahrenheit. And this is usually the first sign. The other S is sunburn type rash, which can present as a red rash located on the trunk, arms, face, legs, palms, and soles that will progress to peeling. And then our last S is systemic symptoms, where the whole body is going to be affected with vomiting, diarrhea, sore throat, and signs of shock. This is in really severe cases where you'll get hypotension, tachycardia, and difficulty breathing. Now, some other things you want to remember about this FemCap device is about repeated intercourse. So according to the FemCap's instructions, if multiple sex acts have occurred, there's no need to reapply more spermicide as long as it's occurred within that 42-hour window. However, more spermicide could be applied if the patient desires that. In addition, the FemCap or the cervical cap does not provide any STI protection at all. If that's a concern, a condom should be used, which will provide more of a protection. And also, after usage, the cervical cap needs to be washed with a mild soap, air dried, and inspected for any cracks or holes. Now, in regards to replacing it or refitting, it's best to replace it yearly, and the patient needs to be refitted for the device if they've had a 10-pound weight change. This could either be a gain or a loss, or they've had a pregnancy or some type of cervical surgery. Plus, it's important to note to your patient if they've had a vaginal birth that the cervical cap may not be as effective as other methods of birth control. And the reason for this is because a vaginal birth can change the cervix, and it can change it in a way where this cap does not work like it should. It can't get a good seal around that cervix, which makes it more likely that sperm can get through. Okay, so that wraps up this review. Now, if you're taking maternity nursing and you need more resources to help you study, I have this book you can get in digital format at nursesarah.com or a paperback copy on amazon.com.